Dr. Ritchie Shoemaker and Dr. Scott McMahon are at the forefront of research on chronic inflammatory response syndrome, CIRS, a condition they believe is affecting up to 20% of the population and is often misdiagnosed as other conditions such as fibromyalgia, chronic fatigue syndrome, and depression. They argue that the root cause of these conditions is actually CIRS, which is triggered by exposure to water-damaged buildings and the toxins they harbor. Dr. Shoemaker explains the concept of CIRS and its connection to immune system dysfunction. He points out that the majority of patients with CIRS do not have proper antigen processing, leading to chronic inflammation and metabolic abnormalities. Dr. McMahon adds that exposure to water-damaged buildings, which can contain a variety of pathogens, triggers an immune response that results in symptoms similar to the flu, such as headaches, muscle aches, and fatigue. The doctors argue that 50 to 85% of buildings in the U.S. are historically water damaged, with modern construction methods and materials contributing to the problem. They highlight the use of antifungal paints and sealants as a factor in creating more toxic molds and bacteria, leading to a higher prevalence of CIRS. They also note that certain architectural features, such as flat roofs and basements, make buildings more vulnerable to water damage. The symptoms of CIRS are diverse and can include fatigue, weakness, aching and cramping, respiratory issues, eye problems, gastrointestinal problems, joint issues, cognitive difficulties, and changes in appetite and weight. These symptoms can be nonspecific and may be mistaken for other conditions. The symptoms can also differ between adults and children. Dr. Shoemaker and Dr. McMahon stress the importance of biomarkers in diagnosing CIRS. They claim to have identified around 30 biomarkers that can distinguish CIRS cases from healthy individuals. These biomarkers include tests for innate immune system function and genetic predisposition to immune overreaction. They argue that the probability of false diagnosis decreases as more biomarkers are tested, making the diagnosis of CIRS more accurate than other conditions with non-specific biomarkers. The doctors discuss the neurological conditions associated with CIRS, including patterns of brain damage such as swelling of the forebrain parenchyma, enlargement of the cortical gray matter, and atrophy of the caudate nucleus. They mention the use of VIP, vasoactive intestinal polypeptide, therapy to address these neurological abnormalities and the potential for using this treatment protocol for other degenerative neurological diseases, such as Alzheimer's. To determine if a person has CIRS, it is important to conduct building testing to identify environmental parameters, such as water damage, fungi, actinobacteria, and endotoxins. Once the exposure is identified, the first step in treatment is to address the exposure by either fixing or remediating the environment or leaving the affected area. The use of binders such as cholestyramine and Welchol is also recommended to address the exposure. These binders can help remove toxins from the body and improve symptoms within 2 to 3 months. Dr. Shoemaker explains that about 25% of people are genetically susceptible to CIRS due to various physiological and genetic reasons. He discusses the role of metabolism in the illness, particularly the disruption of the sarsen-Recan loop, which affects protein production and energy metabolism. He also highlights the impact of insulin receptor substrate 2, IRS2, on glucose uptake and the potential effects of a carnivore diet on metabolism. The doctors discuss the challenges of receiving acceptance and recognition for their work within the medical community. They acknowledge the systemic issues within the healthcare system, including time constraints for physicians and the need for specialized care for CIRS patients. Dr. Shoemaker shares his experience with emergency room physicians and the difficulties of diagnosing and treating complex illnesses within limited timeframes. The doctors also discuss their efforts to bring attention to CIRS among government officials, particularly in relation to military housing. They emphasize the importance of addressing environmental exposures and the need for knowledgeable professionals in mold testing and remediation. Dr. McMahon shares his experience of treating children with chronic illnesses, particularly chronic headaches and abdominal pains. He emphasizes that about 90% of children with these symptoms have biomarkers consistent with a diagnosis of CIRS. He also discusses the implications of CIRS on long-term health and the need for specialized care for pediatric patients. Dr. McMahon emphasizes the importance of understanding the blood-brain barrier in the context of CIRS. He explains that the brain is more sensitive to potential toxins and chemicals, and the role of the blood-brain barrier in protecting the brain from external influences. In conclusion, Dr. Shoemaker and Dr. McMahon present a compelling case for the widespread impact of CIRS and the need for accurate diagnosis using biomarkers. They argue that CRS is often misdiagnosed as other conditions and emphasize the importance of addressing water-damaged buildings as a public health concern. Their research has significant implications for understanding and treating chronic inflammatory response syndrome. The podcast provides valuable insights into the diagnosis and treatment of CIRS, highlighting the importance of identifying environmental exposures, using biomarkers to assess the condition, and implementing effective treatment protocols to address the symptoms and neurological abnormalities associated with CIRS. The doctors also offer valuable resources for further information and support for individuals seeking to learn more about CIRS.